My name is James Rousseau, and I'm a primary care physician at Center for Adult and Family Medicine and for St. Francis. I became a primary care physician mostly because I think it involves many different disciplines, and it's also the focus of patient care. So where you feel like you can do the most good and talk to people about preventative care and taking charge of their own health. As well as it's interesting to me to see a lot of different disciplines and not just one. It's important for me to develop patient relationships because it really helps, I think, make the patients take charge of their own health. So I think if you can develop that personal relationship and you're not just in the hospital dealing with the patients on a one-time basis, they learn to trust you, and you build some goodwill with them, and they really start to listen to you and take charge of their own health. Patients can expect from me when they come and visit the first time is that we're really going to take a very thorough history and understand what their past medical history was, as well as what medications they're on, and really just start to develop that relationship. So so that they understand that we are there for them, that they can talk to us and call us on a need basis, and can see us any day that they want to, just so that they can understand and start to feel comfortable at the practice. The most rewarding part of my job is building the relationships as well as trying to solve problems. So solving problems and not sure what's coming in to the door at any time is one of the things that really interests me, and trying to solve problems and help people, small ways, and then in some very big ways by concentrating on primary and preventative care, which is a big focus of mine, is trying to really help people take charge of their own health and really focus on diet and preventative services. I think what makes a good doctor is someone that the patients can trust, as well as you have to be able to have the acumen and the desire and the devotion to learn more all the time, because I think it's constantly a learning process being a physician, but also being able to listen very carefully to the patients, because much of what you decide to do for the patient is dependent upon what they tell you, and you have to listen very carefully. I chose St. Francis because it is an organization that concentrates on caring for the patient. You can see that from the top down, that they want to do what's right for the patient. There's always discussions about patient care, and I think they're headed in the right direction as far as trying to balance that with some of the very difficult healthcare environment in which we live now. It makes a difference to me that St. Francis is a faith-based hospital, because I think they're always keeping in the back of their mind the patient and patient care, as well as trying to do the right thing, as opposed to just what is most expedient or what's most financially the best for the organization. They're always keeping the patient in mind and trying to give the best patient care. What I enjoy outside of work is spending time with my family. I have a wife and a young son who's 20 months old, and it keeps me very busy. And I also like to be very active and try to practice what I preach, which is trying to eat a very healthy diet, as well as exercising and staying active, and so that I can communicate that to my patients, and hopefully that they can follow suit. The advice I have for patients is to start to maybe think of the doctor-patient relationship as a dual relationship, and I think patients are frequently doing that now, but it does take both ends, and taking charge of your own health, both in terms of preventative care and diet and exercise and nutrition, as well as taking your medications and compliance, and to really have the best outcomes.